Today, it's very appropriate at this time. Everybody's wondering about corona and what it's all about. So with the expert, Professor Anzala, Dr. Mwangangi, Dr. Kitai, you're looking at a tweet. Actually, I'm going to read that tweet. Let me go to that tweet, by the way. Uganda and Rwanda.
Yes.
To further mitigate COVID-19 outbreak, all arriving and departing commercial passenger flights, including Rwandair, will be halted beginning midnight Friday, March the 20th. For a initial period of 30 days, only cargo and emergency flights will operate. The question is, you keep talking about this thing being imported. Why not stop flights altogether? Dr. Mwangangi.
So, Jeff, there is a team that's working on this. The president put together what we're calling the National Emergency Response Committee, and it has the chairmanship of our CS, Mutahi Kagwe. And in that committee, we actually have all the cabinet secretaries who deal with issues of transportation, security, and interior.
Yeah.
The team is constantly monitoring the situation and assessing risk. And the president did recently give comfort that we are letting in cargo coming in order to be able to safeguard the economy. Yeah. And just this morning in the Chinese conference, it was confirmed that this virus cannot be transmitted through cargo coming into a country. And so we are safe in that regard.
Okay.
This committee will continue assessing the situation and will make the determination if we should, close borders and put in place such measures. It's an issue that requires dynamism in approach. It's an issue that requires consideration around the table. And these ministers are doing that day in, day out. They're discussing, they're consulting with different, should I say, regional bodies to decide what the correct decision should be. But for now, I can tell you, with confirmation from the Chinese this morning, cargo coming in will not transmit.
Cannot affect anybody.
Yes,
infect anybody.
Yes.
Okay, Dr. Kitai, there was a picture the other day. Folks on the ferry. Looked like 1 million of them coming off the ferry. How do you sanitize those people walking off the ferry at Mtwapa or Likoni?
The ferry?
Yes.
You know, we are talking about first that there's still no lockdown, so people have to move. Even
yes.
Public transport. I think the ferry, just like public transport, is where it's very difficult to maintain social distance, which is why we are saying that each individual needs to take, these matters into their own hands themselves and wash hands. And this is one of the things that the ministry has considered now, and we discussed this a lot, and the ministry is going to start this immediately, is creating hand washing stations with water and soap. So as you land from the ferry, the first thing as you go away, you should wash your hands before you go, and there should be several points. If you're at Machakos bus station and you're boarding a bus, you've alighted from one, you should have a chance to wash your hands. So hand washing is the best tool that we currently have. Hand washing with water and soap.
And if you don't hand wash, that's your own problem, right? Because if you come off the ferry and you're in a hurry and you go...
No, it's a national problem.
It's
the Public Health Act allows the government to enforce public health measures because you are being a risk to other people.
Exactly.
Meaning that if you don't, we can enforce you to wash your hands because you are a risk to other people. Just the way we sometimes enforce vaccination. And that's how the CS today talked about the need to enforce quarantine. Because it is the Public Health Act gives those powers to the government to enforce those things. So we'll enforce hand washing.
Prof, you're saying?
Because you see, for example, come to KNH during visitation, 20,000 in a day.
How many?
20,000 in a day.
No.
Visiting Kenyatta, yes.
So what do?
Yeah.
You stop it.
Exactly.
Because you cannot say that we shall allow one visitor.
No.
How do you allow one visitor?
Yeah.
So this is a risk because these guys are going to crowd at the entrance.
Yes.
Then there is something called a lift.
A lift.
A lift.
Yeah.
So the best thing is just to say, complete, no visitation for a period of time. And that's what the CEO of Kenyatta and I hope other CEOs of the major hospitals are going to do. But the ferry, eventually what will happen, the ferry must be told that they will have to limit. Yes, it will take longer.
Right.
So people will have to realize that it will take longer. They can say, we'll only take 30 on every trip.
Yeah, but you know
that's the only way out.
Dr. Mercy, at the same time, the Mjengo people, they can't work from home.
Yeah.
They have to go to work every day to earn their 200, 300 shillings. What do you tell those people? They say, I can't stay home. This is my daily bread.
So the president was clear. He encourages that you find means through which you can work from home. But for that Mjengo man, he has a tool, hand washing.
Yeah.
He's able to protect himself. Remember, Kenyans, you actually have a tool to protect yourself. The measures in terms of staying at home are an attempt to reduce that social distancing. But we do appreciate that some of us do need to be out there in the field fending for our families.
Yeah.
But you're not powerless. You have a tool.
Exactly.
Wash your hands.
Good. Here's Mamake Rayo says, is there any blood group that is more vulnerable to COVID-19 than any other? Prof.
That's a question for the professor.
No, for now we don't know. It's unlikely, because from the number of people who have gotten infected, it's unlikely. But it is something that can be looked into critically in terms of science, because we simply look at blood groups and look at the infection rates and look at also the clinical outcomes.
Yeah.
Exactly.
Yes.
But I'm not sure that there is evidence of any other virus in the past that is related to blood group.
Blood group. No, not that we know.
Not that we know. It's unlikely. I think.
Okay.
Yeah.
What about the virus surviving or not surviving about a certain degree? I've been hearing this talk, whether 26, 27 degrees. Prof, is that true or we don't know?
Now, we can compare this to influenza. In Europe and North America, influenza is seasonal.
Yeah.
It comes during the winter. For obvious reasons, people do crowd because they are not outside, they are inside. You go to Europe during summer, the days are longer, isn't it?
Yeah, yeah.
People are outside for hours, isn't it? Go back in the winter, they are all inside, and also the air is dry. So influenza survives. Now, this virus behaves different because it's a cluster. Influenza is all over the place, but this is a cluster. It begins from one infected person and it begins to infect the others. So whether climate will be important or the tropical situation that we are in will be important, only time is going to tell.
Okay.
For now, we really don't have any evidence.
Louis Jumba says, when is someone declared free from corona and how can the person be accepted back in the community once healed? Does the government help the people in matters medical advice? So, Dr. Mercy, if someone, let's say one of these seven, is corona free after a few weeks, how do they get accepted? I mean, there's that stigmatization.
Yes. What we're appealing to Kenyans is we should not stigmatize these people. This is a flu, and I dare say a flu that is almost like any other, only that it has severe effects on your lungs. So when these people are released and allowed to go home and continue with quarantine, they are under the supervision of the ministry. The ministry is actually following up these individuals and ensuring that they don't have recurrences of symptoms. So they're safe. Let's accept them back into the community. Much like the way Kenya has been praised for actually reducing stigmatization in HIV. Let's be examples and use that as well in this case of corona.
What happens to that Uber driver who, the JKIA, he had ferried so many passengers, and then finally in, was it Mukuru at Jenga or somewhere?
Right. So what's happening is much like the xenophobia that the CS spoke against, it's important we realize that this virus, again, is a type of influenza virus that causes a pneumonia. These are not people who we should be afraid of. These are not people who we should treat, ostracize in the community. But most importantly, the Ministry of Health is working with psychologists and psychiatrists. We have a team. And even in the 719 helpline, we actually have a mental health team that will be able to allay anxieties and fears in the community. It's important to note that some of us are, aware of the ill effects that stigma can have. And that's something that we really need to fight as Kenyans and ensure that these people are accepted back in the community. And the government would not push anyone back in the community who is not safe.
Okay, Dr. Gitari, even as Dr. Mercy is saying Kenya is being praised, WHO boss Tedros Ghebreyesus says cases of coronavirus being reported in Africa may not be a true representation because testing is not robust. What do you tell him in WHO?
It is true that actually the numbers of cases, and I said this earlier, the ones we know are the ones we have confirmed and tested. We don't know how many are in the community, and he's right. And that doesn't only apply to Kenya or any other African country. It's many countries that don't actually know. Even when the UK started, they had, they underestimated the cases. So this is true. And the testing, again, as we talked about, we are not encouraging that everyone gets tested because there's really no change in management. The only change is now you know the numbers, and therefore the epidemiologists can map and therefore do surveillance. So the testing is not really the core of corona. It is the community interventions of ensuring that those who may have do not transmit to others by cutting the transmission, doing what we call flattening the curve. You don't want corona to go like this. You want it to go like that and then go away. So our role is not in wondering about when will I get tested, can the government test me? Our role is to say, I have the power with me to actually cut any possible transmission by washing my hands with soap, cleaning surfaces, and being up and moving on with our life, and ensuring that we do not classify and authorize any particular society, because no one is not vulnerable to catching it. I can have coronavirus today or tomorrow. I haven't tested. None of us here has tested, by the way. It's good to tell the public that. None of us here has tested. We haven't tested.
So
I trouble a lot. I haven't tested.
We haven't tested.
Dr. Mercy, there was someone in Kwale District, Kwale County today, who, I think he was a drunkard, and he just claimed he had corona, and they killed him.
Oh my God.
Yes.
Oh my God.
I don't know if you heard about that. They either stoned him or beat him to death. Because he claimed he had corona.
That's very
So that's stigmatization that you talked about.
That's dangerous.
It's like someone saying, I have a flu and people kill him. There's no difference.
That's extreme.
It's like someone saying, I have a flu and then you kill him. Because the flu can also be transmitted. And we know that there are people who die of the flu. So are we saying then that if somebody says they have a flu, they will kill them? It is exactly the same. It's just that this is a new virus. That's why it has such high conversation.
Yes.
There's no difference.
Professor Nzala, there's a question here by Fred Obach Machoka, the blackest man in Black Africa. He says, and it goes to what you were saying in Kibera, by the way, Dr. Ari, but Prof, let me ask you this. He says, please understand it is mission impossible to quarantine kids living in the informal sector areas. How do we mitigate this? Running around all over the place.
You see, the whole issue, we are not talking about quarantine. We are talking about social distancing. That's what we are talking about. You go to quarantine when you have come across a suspected what? A suspected case. Kids in Kibera have not come across a suspected case. So what parents should do is just to ensure that they advise the kids to avoid what? Going out to play with the other kids too much. Just to social distance. Encourage the kids to wash their hands. Encourage the kids not to share lollipops. Those kind of things. Yes, isn't it? Yes, so that's exactly what we are talking about. We are not talking about quarantining
not at all.
Any children. We are talking about social distancing.
And the decision.
It is different when now we shall come to lockdown. But I hope we don't.
Yes.
We don't get there.
I'm glad you mentioned that. Dr. Mercy, can it come to that?
It has come to that in some countries.
Yes.
So it's a possibility. But then again, predicated on how we intervene. Predicated on our community response.
So what do we have? 14 days, 13 days, 10 days? What is the countdown?
Again, we don't know. And no country knew when was the right time to come in and say lockdown. The idea was enhance community response, enhance the prevention measures, enhance those, and then go in there for those who present and are ill, manage them, and enhance the social distancing. And then watch, wait, and see. And that's why we actually have what we're calling an emergency operations center that has a team of 20 scientists who are sitting there and analyzing all the cases, analyzing all the contacts, and doing the data analytics to ensure that we are ready when we need to react. But then back to testing, Jeff, it's important for people to know I could go ahead and test today, but then I could meet someone right after my test.
On the way out.
On the way out.
And get.
So testing is not the issue here. So testing is really not the thing that we should be focusing on. And then you could test negative again, but then tomorrow meet someone. So will you test yourself every hour?
Exactly.
Good point.
Yes, and that's why I was going to say the decision of the president to actually send all kids home is exactly the response that we want. Because in school, the kids are crowded together.
Yes.
When you let them go, then they are at home, and therefore they are different from each other, which is why also we don't encourage a lot of people into isolation. And the best place to isolate yourself is at home, because then you are farther from other people. Okay. Yesterday, I met a child who said, I asked him, what will you do so that you avoid corona? He said, if I touch something, I'll avoid sucking my thumb. The kids know what to do.
Exactly. Exactly.
Just like that.
Yeah.
Anthony from Kitengela, if you can hear us, good evening. What is your question?
Okay, good evening. I'm Anthony from Kitengela. So my question is, are private hospitals allowed to, if they have the capacity to test the viruses, are they supposed to confirm the cases, or this is left for the government only?
Okay. Capacity of hospitals. Thank you, Anthony. The capacity of the hospitals.
The private sector or
private hospitals?
Yes.
If they test and they find that they are allowed to announce, or does it have to be announced by the government?
As it is now.
Yes.
And let's be very, very clear. There's no private hospital in the country with capacity to test now. The two labs that we know is the National Reference Lab and the lab in Cambridge. Having said that, we are now moving very, very quickly to validate and ensure that we can now expand the number of labs that can actually be able to test. Because part of it is that it is not, we don't want to tell you are positive and you are negative, especially if you are a suspected case or vice versa.
Right.
A false positive or a false negative is a total mess. And that's why we want a very controlled approach to testing. So what is happening is that labs will be validated. Those who have the capacity then will be given ability to do what? To test.
So these,
but even after testing, the results will be coordinated.
So there's been a couple of private clinics that say they can test the coronavirus. Dr. Mercy, is that?
These clinics are not accredited by the Ministry of Health. No. And again, in the field, there's actually no quick rapid tests that can be carried out. So those are fake tests. But then, Jeff, it's important to recognize that this issue touches on national security. And so there must be protocols that we must observe in communicating when we do get a positive case, because this touches on our borders and the security of the country. And so there are laid out protocols as to how this should be undertaken. Two, this is actually a disease that we call notifiable under WHO. And under international health protocols, there are ways in which you should communicate positive results. And that's why you're seeing us managing this process, because there are protocols that we are following on, and it's a matter of national security. So this must be governed as such.
Exactly. But can I say two things?
Please.
If you allow me. The first thing I would say, the point we are trying to make here, because we don't want to mislead the public, is that it's not that the private laboratories or the laboratories in private hospitals are weak or they have no capacity. They have no capacity to test for COVID. They have very good lab capacity.
Exactly.
But the testing of COVID requires a particular reagent which they don't have. So it's not that their labs are not good. It is the reagent which has to be accredited, and they have not been distributed to them. So what Professor Nzala is saying, that in due course, the team, the technical team is actually looking at the labs and then supplying the reagents in a controlled manner. And that is really critical for people to understand.
Good point.
And Jeff, just note, we've said that, how old is COVID?
Let's say 3 months, 4 months?
3 months, isn't it? Yes. It's taking time to also develop better tests. So there's no point of care tests.
Exactly. None.
Yes, exactly.
Understood.
That's what we are saying.
Understood.
Yes. So that point must actually be very, very, very clear. So if anybody walks anywhere and they are told, oh, we are testing this, it's fake.
Good point. We've got Ellie from Embakasi. Ellie, if you can hear us, good evening. What's your question? Ellie? It's very noisy.
I can hear you.
Yeah, okay, go ahead. What's your question?
So my question is, the people are talking about alcohol sanitizers,
Listen, Ellie, do me a favor. Just lower the volume on your TV, please.
Okay, I'm saying the people are talking about alcohol sanitizers. So does it mean that if you drink hard drinks like alcohol, you kill the virus?
I can't hear that. His TV is on.
I think I heard it.
Okay, what do you say?
I heard it. I have very good hearing.
Clearly.
So he's talking about
It's age.
Not like
it's
us.
age.
Yeah.
It can't vibrate.
The tympanic membrane. So what he's asking
Yes.
is, if I take alcohol, will alcohol kill the virus? That's what he's talking about.
Vodka.
If I take vodka, will vodka
The same
kill
vodka
the
you wash
virus?
your hands. Is that what? Okay, go on.
And I'll ask the fellow experts to join me here in saying no.
No.
That's not an answer. Don't drink that changa. Don't drink that vodka. It has ill effects not only for your body and many other things, but it will not help you in this corona situation.
Not at all.
And just because we're saying that the sanitizers have alcohol in them and that they're able to take care of the virus, taking that into your body actually causes bands within your body. And that will actually give you a weaker immune system.
Right.
And so should you come into contact with this virus, you'll actually be weaker.
Yeah.
Good point. That's a very good point, by the way.
Yeah.
Use the alcohol to wash your hands, not to wash your...
No, not at all. No.
Okay. And is saying, can COVID-19 be transmitted from mother to unborn child? And number two, as shown in the clip at Gekomba, keeping social distance is close to impossible in the informal sector, and yet these are the very people who cannot afford to miss work for even a few days. What do you advise in such circumstances? And then three, what's your advice for the majority of Kenyans who use public transport? Thank you. Number one, mother to unborn child. Prof.
Yes, we still don't have data on mother to child. Because mother to child could be at 3 levels. The virus crossing the placental barrier, or the virus being transmitted to the child during breastfeeding, or during childbirth. We don't have that data for now. With time, we shall actually get to know.
Okay, Professor Dr. Gitahi, the social thank you. The social distancing, Gekomba, and we talked about the Mjengo man, the social distancing. It's almost impossible to police, if you will.
Exactly. You see, this is why we are saying that we are not helpless. So we know in countries like Kenya and other countries in Africa where majority of the people are in the informal sector, social distance is going to be difficult. But we are saying, if possible, observe social distance. If not possible, continue washing your hands, number one. We have people we call community health workers in this country, community health volunteers, as we like to call them, but they are workers. They do a lot of work. We have probably 70,000 of them across this country. We are advising them and we are training them. AMREF is training, Red Cross is training, and others, together with the Ministry of Health, to then help people where there are difficulties, to make sure they are actually interacting with people and they can tell. They probably will help to man, hand washing stations. So these are the things we are saying. So even where you can't observe social distance, you're not helpless. Wash your hands. We're advising matatu people, taxi people, have something chlorine-based bleach mixed, sanitize. Yeah. If you're going into a market, have hand washing facilities. So these are the things that are going to help, because we've been told this thing is not about aerosols. It's about our hands, about the surfaces, and then we transfer it to ourselves. So even if we are standing, many of us, which we don't want, but if that's the only opportunity that you have, wash your hands. So there are ways out of it.
Good point. Dr. Mercy, the third point was about people taking mass transport.
Right. So again, there are no embargoes on transport for now. But then the matatu industry is being very innovative. Dr. Githinji showed us a picture with a jerrycan at the back of a matatu. We have conductors who are sanitizing people as they get into the matatus. And we even have water points that will be established through the Ministry of Health. And they're working on, Ministry of Health and Water, they're working on that. However, there's one thing that you can do as Mwangangi. Help us. Should the need arise for us to trace your contacts, be cognizant. Which matatu did you get into today? Where were you going? What time was this? And, assist us should that need ever arise, because that's an important element of controlling this. So we're asking Kenyans to be more heightened and more aware of their movements. Right now, the National Emergency Response Committee will determine when they'll put embargoes on transport. That's that committee's responsibility to determine that. But for now, be aware be clear as a Kenyan. As we always say, jijue hali yako. So as you move around in the country, as you go about your duties, be aware so that when we do ask you, who did you meet, you can at least give us some form of account of who you interacted with.
And in addition to what we are saying, we are also encouraging taxis, tattoos, buses, to also just use the JIC for this constant disinfection.
Each time they pick up a new passenger,
yes, exactly. When they are exactly, so that also because we know it is touching the surfaces.
Exactly.
So we are also encouraging that, and it's not difficult. Just JIC, 1 in 4, concentration, and put it in something you can spray, isn't it?
Yeah.
And wipe it off.
Okay. We've got Susan from Kawasukari. Susan, if you can hear us, good evening. What is your question?
My request is, mine is a request, yeah?
Good.
Hello?
Yeah, go ahead.
Mine is a request. As much as they are advising us on what to do to maintain our hygiene, could they please advise us on what we can eat to build our immunity?
Okay. What can we eat to build our immunity? Doc?
Normal food. There's no change of diet for coronavirus, for example. Just keep yourself, eat normal food. And this is a good opportunity to say that generally when you talk about nutrition, nutrition can be good or bad. So if you're taking excess sugar, you are increasing your chances of getting, non-communicable disease like hypertension and diabetes, obesity. So we just want people to eat natural foods, avoid all this fried stuff, avoid a lot of sugar, avoid drinking soda regularly. Just take a normal diet as we were trained in school. Carbohydrates, vegetables, and protein. And the protein doesn't have to be meat. Beans, whatever. Yeah. And especially the folk in the village know how to eat a good diet. Correct. It is us in the urban centers who are actually having a bad diet. Just normal food.
True.
Keep it going.
And one more thing, take care of your mental health. Let's support each other because mental health does have a correlation with your immunity. So call on your friend. How are you doing?
Yes.
Call on your mother. Check on your father. Check on your grandmother. How are you doing? Are you handling this okay? Share information and keep calm.
Exactly.
And keep calm.
Keep calm.
Prof, let me ask you a really dumb question, but I'll ask it anyway. A lot of pictures we've been seeing on TV, people in supermarkets buying toilet paper in plenty. What's up with that? What does that have to do with Corona? Is it just me?
I really don't know what this piling is all about. Because we have been assured that commodities will come in.
Yes.
Isn't it?
Yes.
Government is put, commodities will come in. So this panic is totally not, necessary. Yeah. This panic is totally not
but you didn't
necessary.
answer the question. Why toilet paper?
I don't know why. Maybe you guys know.
Maybe people are scared. I'm sorry, I can't say the word.
Just leave it like that.
The toilet paper story.
Yeah.
All right. So, Dr. Mercy, salons and barbershops.
Right.
Talk to me.
So in China, these were banned. In Italy, ladies, stay at home. This is not the time to go crowding in salons and in malls. Do your own hair. Do your own nails.
Oh my
Room at
God.
home.
Are
Jeff,
you kidding me? Miadi.
I was wondering.
In addition to gyms.
Gyms.
Yeah.
No need. Aerobic classes where you're all in a room sweating and huffing and puffing. Need.
Let's walk on the road. Let's jog on the road.
Yeah.
Public swimming pools.
No need.
It's just for a short time.
Yeah.
It's not like a change for life. It's just for a short time. And we're saying when you actually make a choice to keep social distance, you're saving not only yourself, you're saving others. It's actually an act of kindness.
Exactly.
When you make a choice to keep social distance, it's an act of kindness to others.
So it also gives us an opportunity to innovate.
Yes.
Yes. Just like what the Ministry of Education is now doing, isn't it? Yeah. How do we innovate to keep the kids at home busy? They are now going to air the various programs on KBC.
Yeah.
So even as if you are a gym freak, innovate.
Right.
Isn't it? There are places to jog safely.
Absolutely.
All right.
Good point.
Do yoga in the house.
There you go.
Yeah.
One more point. If you already have the common cold, people get colds every now and then.
Yeah.
How do you differentiate it from 19?
I said earlier, we do not want the general public to become experts in distinguishing.
Yeah.
If you're not worried, it's fine. If you're worried, call 719.
Exactly.
And you'll be advised as to whether you should just stay where you are or whether you need to worry. So do not rush to the facility, to the hospital, and do not try to diagnose yourself whether this is COVID or not.
Yes.
Just call
Suddenly
719.
you're an
If
expert.
worried, you're not an expert. And we are not trying to make anyone an expert.
Yeah.
No. Call 719, you'll be advised.
Because there has been so much communication to the extent that anybody feels, oh, there's a cough. Are you coughing? They'll say, are you having fatigue? Call that number, it will assess you critically and then advise on what to do. So we shouldn't worry. And that's what is, this miscommunication is what has brought in panic and fear. And panic and fear then start causing what? Stigma.
Paranoia and
and
stigma.
Paranoia and stigma.
Yeah.
And those are the things we really want to totally reverse and remove completely.
We'll talk to
Jeff, Kenyans need to know that coronavirus is not the only virus or disease we have in the country. And we want to let them know that our health facilities are safe. And so mothers, bring your children for immunization. Don't stay at home. In fact, that act of not coming to the health facility to immunize your child can actually cause much worse diseases than corona.
Right.
Mothers who are pregnant, come in for your ANC visits. The hospital is safe. So, we don't want to have unintended consequences and have Kenyans, start having poor health-seeking behavior because they're afraid of hospitals. Come to hospitals. The hospitals are safe. If you feel unwell, if you have any other condition other than corona, do not be afraid of the hospital.
Right.
Exactly. And don't crowd the hospital because you cough, because then you have the negative result of what she's saying, that now you overwhelm the hospital just coming because of curiosity and panic, and the mothers and children who need the services cannot access them because you overwhelmed the health workers. That's why we are saying keep calm, stay where you are, and let the people who need the facilities use them.
Prof, you're the expert here. I'll leave you with the last word. Worst case scenario, best case scenario.
The worst case scenario is us looking at the numbers go up and then quickly realizing that we are now in a community transmission. Because when we reach the level of community transmission, then it means it's no longer imported. It's now all over. We have so many focal points. That actually is a worst case scenario. And that now will require another heightened level of lockdown. Best case scenario is the kind of things that we are doing now to avoid community transmission. Or even if we do reach there, then the curve will not be like this, but the curve will be like that.
Flat.
Flatten the curve.
Yeah, because the whole issue is that we don't want to overwhelm our healthcare system.
By the way, I don't know if you guys know this, Citizen Television is changing our programming from tomorrow. Every top of the hour, we have a news update on coronavirus. Every top of the hour, all day long.
That's very responsible, and that's what we're encouraging all the media houses to do.
Great.
And I would like you to offer me your social media pages for free to communicate to people.
Absolutely.
Thank you.
No, really.
Thank you. Kenyans, Jeff has just offered the social media pages for free for us to talk to people about coronavirus.
Fantastic.
For a period of 14 days. Further which we will have to review
the contract.
No, absolutely. With pleasure. And if you guys need help, come to us. Come to us.
Because the situation you talked about, is it Kilifi?
Kwale.
Yes.
Is
really,
despicable.
that must be reversed.
Can you imagine?
And reversed very quickly.
And the other parts of the country where people are unaware or ignorant, for lack of a better word.
Exactly.
Send
it's
it our way.
It's a new flu. That's why it has a lot of attention, and we are studying it, and no one should panic. Do not take measures like what that is really, really sad. Because this thing is in your hands. Wash your hands, observe hygiene, and keep yourself safe. And then as much as possible, keep social distance. That's it.
Social distance, that's key. And wash your hands.
Wash your hands.
Keep Pande soap.
Yes.
Wash your hands.
Jig with water. Wipe.
And one more thing, Jeff.
Go on.
The president will be hosting a national prayer day.
That's right. This coming
Kenyans,
Saturday.
Let's come together, and we are a praying nation. So let's also put this before God. But remember, the power is in your hands. Wash your hands.
Like literally.
And the
Literally in your
virtue,
hands.
isn't it?
Yes, it's going to be. Yes,
It's
it's going to
virtual.
be organized in
It's
a
a
virtual
virtual
mode.
prayer. Yeah.
Dr. Mwangangi, Dr. Gitai, Professor Nzala, thank you so much for your time, guys.
Thank you.
We really appreciate
Do
it.
you remember the word he told you, the big one?
No.
Okay, then you can't be professor. So that-
You missed it at
Wait.
opportunity.
I have withdrawn.
It wasn't reoccur, it was
Recur.
Bas,
recur.
okay, I've given you back again.
part of it.
Very.
He's being polite.
I've given you back again.
Thank you.
Yeah.
Guys, thank you so much for educating
Thank
us
you.
tonight,
Yeah.
informing. What's that? Oh, yeah, there's a question about street families, street kids, street families at this time. Doctor, Mercy?
So again, the NERC is looking at that issue, and they're in deliberations to see how we protect these children and street families.
Yeah.
And the different ministries are actually engaging in terms of trying to, do surveillance through the Ministry of Interior, ensure that these families are also aware of the measures that they can take in place. But again, another evolving situation that we're looking at. We do have groups of philanthropy who've come to us and have said they want to work with us to see how we can provide measures for these families.
Exactly.
Yeah.
And if I can say, the business community, we haven't talked much about it.
Right.
And I know we can talk about
No,
that
you can
another
mention.
time.
You can mention.
In the business community, the private sector is so key, because if you look at this country, the business community employs a lot of people, and therefore how they respond in terms of making the workplace safe for people, disinfecting if they need to, making sure that they stagger the number of people who come to the office so that people don't congregate, especially where there is limited space. We've had this conversation. And the business community has come together and formed what they call the National Business Coalition for Response to Coronavirus. And we have many other people coming together. And there will be fundraising as well to make sure that we can respond. We can actually respond to people like street families, make sure there are hand washing stations across the country. And we'll be announcing the fundraising plan. But the fundraising, again, I want to tell Kenyans, is not because the government doesn't have the money. The government has the resources to respond to this. So this is just additional resources to help the people themselves to actually break the transmission, not to the government has its own resources.
Right.
But we all need to come together to support each other as we are.
Dr. Mercy, what do you tell those people who keep hiking prices of sanitizer and all that stuff? They're hiking them. It's not fair.
The president was clear. It's unethical. It's morally wrong. Yep.
Yeah, and we had one clinic, I wouldn't say the name, that started advertising.
Yeah.
We advertising a quick
I saw that.
test.
I saw that.
And we picked it up very quickly. And we went to the board and we reported to the Ministry of Health, and they took action. And actually it was closed because it was not doing the right thing. So we are very clear that this is actually a whole of society approach. It's not Ministry of Health or government, it's a whole of society, you and I. And remember, none of us here has been tested. So the testing is not the center of the coronavirus response. But each of us here has been washing our hands. Wash your hands.
Exactly.
Do you know a guy called Dennis Chebitwe?
Yes.
He says hello.
Hi, Dennis. I know him. Please look for me.
And he also says Ministry of Health doing great work.
Yeah.
Fantastic. Thank you.
Thank you
Working
all
together.
so much, guys.
Great.
We could go on and on. You know that.
We
The
could.
tweets are coming in so thick and so fast. We could do this all night long.
We'll respond to them on the social media.
We
Good.
respond
We will.
on social
Give them your
media.
handles. Give them your handles.
My handle is @Daktari1, not Doctari. Daktari.
It's not
1.
Gideon Moyes,
No,
Doctari.
Daktari1.
That's your handle.
Yes.
Mercy?
This is at MOHK. At MOHK.
MOHKE.
No,
Good.
I don't tweet.
Oh, excuse me.
I don't tweet.
Viruses are not on Twitter.
Others tweet on my
They're
behalf.
too busy.
Well, we can't question that one now.
But we can always come back if there are many other issues. Just to unpack the whole thing. Because we really want to ensure we are proactive throughout.
Yes.
Yes, we are now in the response phase.
Yes.
And we want to be totally proactive.
Wonderful.
Yes.
There's a guy we call Coach around here. Washira Waruru.
Yes.
Group MD.
Coach.
He says hi.
Coach, hi. We'll meet again where we met last time.
Oh. Oh, okay.
That one, leave it there.
And Francis Gashuri. Goodness, you have a whole fan club.
Oh, yeah, our fan club. There are many of them. And where I met Coach, he sent me with something for you in your house when I came to visit. We'll not talk about it in public.
It was fantastic, by the
It
way.
was, wasn't
I
it?
think we want to know what this is. Right.
What a great panel, folks.
Yeah.
Listen, maybe in a month's time or
We
6
should.
weeks' time,
Exactly.
let's revisit this situation.
Sure.
Yeah, it's your
See
choice.
where we are.
We
It's your
should.
choice.
Sure.
Yeah.
Yeah.
What do you think?
and we hope the curve will be going down.
Yes.
We'll have flattened the curve.
Good luck, folks. You guys
Thank you.
have your work cut out for you, but you are definitely up to the task.
Thank you.
And we wish you the very best.
Thank
Thank
you.
you, Jeff.
Thank you,
And
Jeff.
thank you so much for joining us tonight on this very important conversation about Corona, COVID-19. Very important. Your questions are important. And yes, I hope you learned something, just like we did today, from these amazing, amazing experts. Keep tweeting at Mwangangi Jeb. At Citizen TV Kenya, the hashtag is JKLIVE. Remember those 3 letters on the keyboard that follow each other, JKL, every Wednesday, right here on Citizen Television. Once again, programming on Citizen Television changes as of tomorrow, March the 19th. Every top of the hour, updates on the coronavirus, and then programming changes in between. Please check it out from tomorrow. And all the latest updates right here on Kenya's and East Africa's leading network. Thanks so much for joining us. Good night, good luck. God bless us all under these circumstances.